This is Dr. Diab, and on today's episode of Just What the Doctor Ordered, I will be talking about glaucoma. It is one of the most common eye diseases that both ophthalmologists and optometrists screen every patient for. The reason screening is so important in glaucoma is that it is a condition that does not have symptoms, so you won't know if you have glaucoma. For example, it doesn't make the eyes red, or the vision blurry, or cause eye pain, or anything that would be noticeable. Glaucoma is characterized by an elevation in the intraocular pressure, which is the eye pressure. But some people can have glaucoma even with normal eye pressure. Average eye pressure runs from about 10 to 21. In patients with glaucoma, they incur damage to the optic nerve of the eye. The optic nerve is like a cable cord connecting the back of the eyeball to the brain, transmitting the messages back and forth. When we look into a patient's eye, we can only see the front of that nerve. There is normally a central excavation in the nerve that we call a cup. The front of the nerve that we can see is called the disc. So the amount of cupping is called a cup to disc ratio. People who have glaucoma will often show increased cupping over time. Some people have a large cup naturally and it is not changing over time, so that does not indicate glaucoma. When the central cupping increases, it is due to thinning and damage to the nerve fibers of the optic nerve. That damage shows up on a test we do called a visual field. The visual field is a test of the peripheral vision. It can often pick up on subtle areas of damage caused by glaucoma. Those areas of peripheral vision loss are small and cannot be noticed by a person in everyday life. So it is critical that we do a visual field test to detect them. Sometimes people have been told by one doctor that they have glaucoma and by another that they don't. This is very confusing to patients. However, the reason that this occurs is that we often cannot diagnose glaucoma for sure until we have seen some changes over time. So if I examine your eye for the first time and I notice you have an enlarged cup to disc ratio, I will then suspect glaucoma, but I cannot say for sure that you have glaucoma unless I have noticed that that cup to disc ratio has increased over time, or unless I find actual loss in your visual field test that is characteristic with findings of glaucoma. Some people have elevated eye pressure, but they don't have damage to the optic nerve or visual field loss. So this is another thing that can be confusing. Depending on how high the eye pressure is running, it does usually cause an increased risk for glaucoma. So in those people, we either need to watch carefully or we may decide to treat for glaucoma to prevent damage. The treatment for glaucoma comes in a few forms. One of them is using eye drops to lower the eye pressure. Another method is to use laser treatment to lower the eye pressure. And in later and more advanced stages of glaucoma, we sometimes have to do surgery. The important thing to know with glaucoma is that treatment needs to be instituted at an early enough stage to prevent damage, and it needs to be monitored closely to make sure that it is effective. So it's really important for a person who has glaucoma to make sure that they're getting continuous care with their ophthalmologist and following up regularly for the appointments, using eye drops if they've been instructed to, and using them at the proper times and regularly without missing them. In summary, glaucoma is a disease that is often characterized by elevated eye pressure that causes damage to the optic nerve that results in loss of the peripheral vision. Our goal is to detect glaucoma early and treat it to prevent visual loss. In most cases, visual loss from glaucoma is very preventable with the proper treatment and care. As always, this video should not be construed as medical advice, and you should see an ophthalmologist if you have questions about glaucoma or want to be evaluated for glaucoma. In a future episode, I will talk more about the laser treatments that we offer for glaucoma. Thank you.